Each practice needs to determine whether or not social media is right for them. The first thing to do is to think about the goal and strategy for going on social media. Some practices may want to go on social media to engage with their patient community. Other practices may use it as a marketing tool to have more patients and traffic going to their actual website. And other practices might see it as a tool to actually get patients physically in the door. It's important to make sure that you have a social media policy in place and a dedicated person to answering on your behalf. One of the leading advantages of using social media is for patient education. Oftentimes it's very useful to have perhaps the most frequently asked questions on the social media site. The doctor's company's position on social media is that it's a wonderful tool that can be used in a variety of different ways. If used appropriately, it can engage the patient in their own healthcare and enforce patient education. However, it can also lead to the eroding of the patient-physician relationship as well as potential breaches in HIPAA. There are 3 inappropriate ways of using social media. The first is identifying a patient to your practice without their consent. And we're not even speaking about clinical information. We're talking about PHI, protected health information, that could identify a patient to your practice. The second way to inappropriately use social media is befriending or liking patients. We want to make sure that our professional lives and our personal lives are kept distinct and separate. The third way of improperly using social media is to be overly familiar with your patients, which can cause confusion with the patient-physician relationship. There are several things to consider when you're communicating with patients via email. First of all, it needs to be HIPAA compliant. You want to be sure that your email communication is secure and encrypted so that in the event the information is breached, you don't have to report that to Health and Human Services. You also want to be sure that the email is saved into the medical record as part of the medical legal document. Other businesses such as retailers, retail shops, as well as restaurants have been subject to consumer review sites. However, it's been only recently that healthcare communities have been subject to the same review sites such as Yelp, RateMD, Angie's List. And the concern is when the doctor or the practice gets a negative review. If you feel that you need to contact the patient or if you need to respond to the negative comment, make sure that you keep in mind confidentiality laws. Do not identify the patient to the practice. Keep the comment general, something along the lines of Dr. Jones is interested in hearing feedback. However, due to state and federal privacy laws, we are precluded from doing so on this site. Please contact our office and we'd be happy to speak with you personally. Whatever your goals are, it's important to make sure that you have the right resources in place to achieve them.